Well, thank you, Chairman. Ms. Savage, you and I talked in my office about how you've been able to reach so many high school students, not only in the state of Indiana, but really increasingly across the country through work with the 525 Foundation, which you established. You indicated how so many of these kids have no idea whatsoever, or very little idea about the risk associated with prescription pills and the risks they pose to their health and the health of loved ones. I think a lot of adults lack that awareness as well. How, in your mind, do we bring more awareness to this issue to high school students? And do you think we might need a broader public awareness campaign to address it?
Sure. Thank you for your question. Absolutely. I know not just with high school students, but also middle age students and also elementary age students and also adults. I think a big campaign with a public service announcement, a national campaign would be awesome because it would touch so many different people, different age groups. Absolutely.
Thanks. We had a little dialogue about
that
we
did,
last night, recalling the This Is Your Brain on Drugs ad years ago.
That we still remember.
There might be an analog to that. Dr. Bell, I'm going to turn to you, sir, and I would like to discuss the issue of predictive analytics. By way of background, Marilyn Moores is a juvenile court judge in the Indianapolis area. And she recently said our traditional systems of early warning related to child welfare cases are overwhelmed. With caseworkers stretched too thin, we end up with a bunch of kids who are falling through the cracks, not just in Indiana, but we see this around the country. But imagine if we could use existing data to help those caseworkers in targeting much-needed services to those children who are most at risk. Child welfare expert and former Michigan Supreme Court Justice Maura Corrigan said, if we're able to mine data in child welfare and intervene with good casework by the mining of that data, perhaps we would reduce the 1,500 to 3,000 deaths from child abuse and neglect in this country each year. I'm going to ask you, Dr. Bell, how might we use data to estimate risk for children? And should we be using data from past cases in order to inform decisions about current ones?
Thank you, Senator Young. I would just say about predictive analytics. We must first understand that it is a tool and not a solution unto itself. But predictive analytics is a very valuable tool that has been used for years in the healthcare field, in law enforcement, in meteorology, and it is essentially taking the things that we know, analyzing them to help us better predict the things that we don't know. And if we can utilize this tool that has shown so much value for others, aviation, airplane crashes, predictive analytics has been paramount to reducing those. And so I think that we have to explore every possible opportunity to do better for our children. And we believe predictive analytics is one of those things that we can explore.
Well, thank you, and I agree with you. I think sometimes we come up with fancy names for things that have been around a while. I guess this is forecasting, and we ought to apply it to this field to improve the lives of our children. So thank you. With my remaining time, I'm going to ask you about reporting. Sometimes a boring issue, but if you don't have clarity about an issue and there's not proper reporting, you don't really have a clear picture of what's going on, and oftentimes the solution is poorly targeted. So nearly 11,000 children entered the foster care system in Indiana in fiscal year 2016, with at least 58% of these children entering care because of parental substance abuse. However, both experts and child welfare agencies believe this percentage to be underestimated. Nancy K. Young of Children and Family Futures said in a 2016 Senate Finance Committee hearing, not a single state believes these data accurately reflect their experience and tell us that these numbers greatly understate the vast majority of cases in which a child is placed in protective custody or are related to parental substance use disorders. So I guess I've got about 15 seconds left, and I too want to be respectful of my colleagues. Yes or no? Do we know the full extent substance use disorders are associated with the number of them being placed in the foster care system?
No, we don't, but we can.
Thank you.
And we can correspond on that.
All right. I look forward to that.
Thank you.